Hey guys, it's Dr. Emer in West Hollywood, and we're doing a great procedure today called InstaLift. This procedure uses sutures inside the skin that are made of a dissolvable sugar-based material that builds collagen over time. It's a great alternative to patients who either don't want to do a lift right away or want to build, just get a nice little lifting, subtle lifting in their skin. And also it does help the overall texture and look of the skin because of collagen production from the sugar-based material that's in there. And we insert, these are called bi-directional threads. So what we do is we basically, watch the video. We take a central point that we've measured where we want to get nice lifting, and through that central point we insert a needle, which is very small, to give a direction of where we want to get a lift. We call this a vector. And go ahead, get here. Good. And there's numbing medicine, so you don't really feel it much. But we then guide the suture through the skin to the place that we wanted it to lift in one direction, and then we go in the opposite direction. And in the center of this, there are little baby cones attached to the sutures. These cones allow the skin to lift and adhere to the new elevation point, so that over the next 3 to 6 months, she gets tightening. She's gonna see it pretty much instantly, but everyone always tells me that by 6 to 12 weeks, they really start to notice a big improvement. Let me show you guys the cones here. You can see the threads here with the different cones, and there's a center, so the skin adheres to this middle portion and lifts up from these cones, and these sutures then dissolve into the skin. So we're almost done with half of the face, and once we're done, we can ask our patient how it was, because you don't want, this is an in-office procedure, and we don't want this procedure to be painful or tormenting. But it should be relatively easy. You can always add more threads, but you don't want to do too many in the first treatment. One, just to make sure, obviously the result is phenomenal, but two, because you don't want to overlap, you don't want to overlap any of these cones. It's very important that they adhere properly into the skin the way that we want it. We've measured this out precisely. Just drop the cap so we have to get a new one. And that was it on half the face. How did that feel?
Oh, it didn't feel, I didn't feel anything, but I'm curious, what happens to the cones?
Cones dissolve too, but they dissolve at a slower rate. And they actually, initially, when we tighten them, you'll notice a little pulling there. Some people it's a couple days, some people it's a few weeks, but it's very minimal. The longer that is, it's actually better for how much tightening you get. So if you start with a little more looseness, you're gonna get that tightening effect a little bit longer, but the result will be better. Now we're gonna go to the other side. I'm gonna show you guys a couple more. Lift your head up for me, and then turn your head all the way to the right. Perfect, great. I'm gonna do a couple again so you guys can see. But yeah, we make that center, yeah, that was a very good question. You know, of all the people we've done, which is very many, no one has asked me what happens to the cones. Quite an intelligent woman.
You know what was interesting also? I have problems breathing out of the right side of my nose, and for some reason, I'm breathing out of that side. Is there any way that...
I'm not gonna even answer it because I just wanted to continue. I don't even want to jinx it. No, I don't know. I mean,
that's interesting.
I don't know, but you know, I did inject numbing medicine around there. So I'm wondering if maybe you need something that has some lidocaine in it in your breathing passage to calm some inflammation or something. Maybe it just helps you breathe better. So you can see here, if you guide this properly through the skin, it looks like a fish underwater, okay, the needle, and we go right up into hairline. We hide everything we do. We don't want anyone to know. And we just guide that in. It fits in there perfectly. Totally hidden. No one has to know. Do one more. Again, central site for the bidirectional cone. All have been numbed. Go right in there, follow the plane, make sure the plane is correct because you don't want any bunching or pinching. Go this way. Always watch, you know, you can always get a little bruising and swelling when you do these things, but in general, with the numbing solution and with how carefully we glide these, we really don't get much issues. We had actually a few celebrities do this the past couple weeks, and they've already been out in the media, and no one has said anything, which makes me really happy. As long as someone says something good or not at all, we're happy. So we'll do one more to show you guys, because the lip corner is one thing that women really feel, you know, ages them. We can put a thread directly at the edge of the lip corner to get that to lift up, rather than, and we put that right over here, rather than focusing Botox here, because that sometimes can cause the lip corner to actually droop if it's not done properly. Right under here. And so this is, anyone say anything? You guys? Comments? Go ahead.
Can you tell us what it is?
Yeah, again, I'll just repeat one more time that this is the InstaLift procedure that uses bidirectional dissolvable cones to lift the skin. She's doing phenomenal. It's almost done on the side already. So where you guys can see, I want to show you this is the end of the InstaLift procedure. Look at the sutures, look what it does. This is how much it can lift. And right now the cones are all holding here, but over the next 3 months it's going to go like that. Okay, so from here to there. You can see that movement. What we do now is we just adhere, make sure everything's adhered under the skin, and then it's smooth, and we check it in the next week or two just to ensure it's all safe and everything looks fine. Right now it looks great, feels very even, there's no issues that I foresee. Just gotta make sure you cut out all these correctly because they're over in the hairline. Okay, so we cut those little sutures out. How did it feel?
I hardly felt anything.
That's really good.
Yeah,
I like people to hear that, because it's a cool procedure because you can do more.
It's amazing. I mean, you can
Yeah.
feel your movement, but there's no pain.
I know, isn't that interesting?
Mhm.
Let me turn to the left a little. I want to show everybody. You see this little puckering right here? That's how much of her skin lifted. It's about an inch over there. I mean, you can even see that now. Imagine what that will be. We've already tightened them, but I'll show you again. If we grabbed kind of these lower ones, you can see how much we'll tighten here. If we grab some of these upper ones, look how much we'll tighten there. So we activate cones, we tighten by activating the cones, and that's the one that kind of feels a little uncomfortable.
Oh, this one felt the most uncomfortable down
Down
here.
at the lower, yeah, it's always by the jaw because it gets really, really tight there. And so we just remove these will then dissolve in, and again, like I said, right now you can't really tell what it's going to look like, but you see this bunching here. That's a good thing. That's what we want to see. That means that it's going to tighten up. Okay, we'll find those little ones. Don't want to remove any hair. And pull the thread separate. And pull the hair a little bit. Good.
Right here.
Mm-hmm.
Is that
No, we're all good.
So you said, I read that she needs soft food.
Yeah, I just tell people to be super careful. I mean, that already looks great. Look, you guys, you can see the folds are much less. This is already tighter. She's a little more lifted through here. The goal is a long term of how much lifting we're getting. I always tell people, try not to exercise seriously for 3 to 7 days.
You don't have to worry about that with me.
That's fine. If you want to, you can after 3 to 7 days. Now I'm going to put in the smooth threads.
I need
now.
something that makes
Hold on.
me exercise.
Turn a little bit. Well, you have John. John is like an expert. So again, you had some fine lines. What we want to do is right where we're at the edge of the comb, we're going to put in some twist threads. Those are going to kind of scaffold. These are little sutures. You're going to scaffold her fold and build even more collagen in there. Good.
This is fascinating.
So these little ones, you see the little twists on there? Those are little baby threads. These don't lift. These build, just plump or build collagen right there.
How do they build collagen?
They actually are made of a material like what's in sutures during surgery that become a little reactive. You don't notice it, but it's under the skin, and then it tells the body to replace it with collagen. Yeah, it's really interesting. So now the next part is the lower corner of the mouth. We do that same thing. Go right over to here, give a little bit of lifting to that marionette line. And do 2 right in there. Right up, and you can even do these in the lip to build lip volume, which is amazing. Turn this way. So again, following where she has these lines, right across, just right up into the lip line, those twist threads. So again, these little baby ones are on a suture, or suture on a needle. Those become collagen, and you can overlap these with different threads, which is what we did today. We basically used your lifting threads overlapping with the collagen producing threads. Turn a little this way, and then I'm just going to throw, how many do we have over there?
We have 5.
5, okay, I'm going to do a couple right in those areas where we put the filler before to just build a little collagen in the fine lines. And another great place that you can put them is back by the edge of the ear over here, because a lot of people will get wrinkles and stuff in that area, so we often will do that, but we're going to focus on the fine lines here today. Good, let's go to the other side. That same thing, just wherever you have any, laxity, crepiness.
Do they do this in arms?
They do.
Really?
They do, yeah. And I have an idea for that for you. A good idea. We'll talk about that. They do. Okay, perfect. So now let me see. I just want to make sure everything's how I want it to be. Great. So that's a combination of finishing the InstaLift plus doing a smooth and twist NovaThreads for collagen building.